Yeah, so they could train harder,
Right.
so they could get an adaptive response.
Right.
But in order to be able to do that, they've got to get the proper rest and proper nutrition,
Right.
and have that reserve, or they'll actually get weaker.
Right. And that is a whole other can of worms that is exactly where the next parallel was, which is the central nervous system and the 4 key stressors. So, I know Jim Laval has been a huge part of the education in the pharmacy world, and his involvement as a integrative pharmacist in the professional athlete world is huge. But he was very impactful on me in understanding that if someone's deficient in their training and you want to super compensate to build muscle, build mass, get ready for the season, right? But if their central nervous system is in a state of fight or flight and it's stressed, the central nervous system is not going to build muscle. It's not going to trigger hormone response. It's going to trigger stress response. And so the other, I would say parallel I've noticed is the 4 key stressors, which I have here, but this illustrates these are all the 4 key stressors on the brain, which is inflammation, blood sugar, sleep or circadian rhythm, and mental emotional stress. Those 4 stressors impact the brain the same way. And so in thinking back, like what a fool we were to believe that our athletes were getting stronger and faster while they weren't sleeping, they were drinking all night. And it's just clueless, right? But how does that parallel, to us today as just being human beings who want to perform well, who in their daily lives and we're all seeing clinicians as patients, or you as our clinicians, which is if you think that you're going to maintain a healthy mental state, right, with good neurotransmitters, and if you think that you're going to maintain a healthy hormone state with great hormone production, you're insane if you're not managing inflammation, blood sugar, circadian rhythm, and mental emotional stress. And I know hormones, bioidentical hormones have done a phenomenal job of bridging the gap and accelerating medicine forward. But people have to remember why they got there, right? Why did you arrive at estrogen challenges, testosterone challenges, progesterone challenges, and what is the root cause of that? And the root cause of that is the 4 key stressors. And so I can't say how much I have learned in this category, which is like, what do you have for hair loss? What do you have for testosterone production? What do you have? The answer to all these things is the root is the 4 key stressors. I have ways to limit inflammation and blood sugar dysregulation and improve your sleep and manage adaptogens for mental emotional stress. And if people can understand that the HPA axis and your central nervous system are connected as one, and the 4 key stressors tax those, then you can start to work backwards on, okay, well then how do I optimize my hormones? And it's a long conversation, but like I think back on how much focus is on anabolic function for athletes. And the answer to all of that was like, well, you need a detox. You need to manage your blood sugar. You need to sleep. And you need to stop mentally being so dysfunctional and practice some stress and relaxation techniques, and all of a sudden your hormones will start to balance. So yeah, that's complex, but looking back, that's probably what I would have focused on more, would be managing hormones to the 4 key stressors.
Well, I think those 4 key stressors have caused a lot of issues with health in patient population. I can't speak to the athlete necessarily because I wasn't as intimate with them as you were working with them in general. But, when I think about what's happened with patients over the last 20 years, I mean, testosterone levels in men have plummeted.
Right.
I mean, we used to never is a strong word, but, usually rarely see a low testosterone in somebody in their 20s.
Right.
And now we see it regularly.